Hi, all of you. Welcome back for the yet another lecture by Dentlamis Academy. And today we'll be starting with our new subject, which is general pathology. Okay, as I have discussed with you on the WhatsApp about what are the chapters important, I've given you the schedule, and I've also told you that there are certain chapters which we will discuss in some other subjects, like, for example, shock, we will discuss in general surgery. Okay, diseases of blood we'll be discussing in general medicine. So there are certain areas where we'll be discussing few things in some other subjects, but when it comes to the general pathology, there are some very important. It's a very simple, very like what I call, it's a very simple subject, it's a very short subject, but if you consider general pathology as such, there are certain areas where you can easily score. Okay, and there are certain areas which are really important, which you can easily score. You just need to know the basics. Like, for example, the one we are going to start right now, cell injury. Okay, cellular adaptations and cell injury. Then there are certain inflammations. Okay, another thing. Okay, before that, there are certain chapters like inflammation and all, bone healing and all, which will help you to understand the overall concept in medicine. Okay, whether it's general medicine, even if it's oral pathology, whether it's microbiology, all those things, the basics comes from here. General pathology is such a beautiful subject. It starts from the very basic, unlike any other subject, it starts from the very basic, like cell injury, how cell injury happens and what happens during inflammation, how, like, all those basic things, we can learn it in general pathology. So there are certain chapters like neoplasia, very important. There are certain chapters like genetics, it's very important, and you get few questions from here and there, and it can be easily scored. Okay, it's a subject where you can easily score marks. Okay, now so if we start right away, the first thing is that I'll just show you what happens, and like what is actually happening during cellular adaptations and cell injury. Okay, if you consider this to be a normal cell, okay, we have got a very normal cell. What happens is, if there is some noxious stimuli, okay, some external cause, what happens initially is cell tries to adapt. Okay, that is known as cell adaptation. Okay, cell tries to adapt, and this process is known as cell adaptation. We'll study about that. Now imagine if the injury is slightly higher than this, or the noxious stimuli is slightly higher than this, then it can go for cell injury. Okay, or it can be directly, if the injury or if the noxious stimuli is very severe, it can directly go for injury without cellular adaptation. And then we will see later on that cell injury is of two types. It can be either reversible injury, or it can be even irreversible injury. Okay, so this is what basically we are going to study in this chapter. What is cellular adaptations, what are the different types of cellular adaptations we are going to study. Then we are also going to study about how does cellular adaptations lead to cellular injury, and what is the mechanism, and what happens in reversible injury, what happens in irreversible injury, and what are the different types of irreversible injury. So this is a basic thing we are going to cover up in this chapter. Okay, so let us first start with cellular adaptations. Okay, the first topic I want to discuss with you today is about the cellular adaptations. Now, if you consider cellular adaptations, there are different types of cellular adaptations which you have to know, which you are very familiar with, but there are certain examples which you have to study. And second thing is that you have to study it in a very systematic order. Simply by hearting things up won't help you. So I'm going to give you a systematic perspective of these cellular adaptations. So what are the different types of cellular adaptations you could see? One is typically hypertrophy. You have heard of it, isn't it? Hypertrophy, simple things. Okay, the second is hyperplasia. Okay, hyperplasia, you have to clearly understand this terminology. Not just hypertrophy is increase in number of cells, sorry, hypertrophy is the increase in size of cell, and hyperplasia is increase in number. No, you have to clearly understand what happens in each. Then there is another thing called atrophy. Okay, and finally there is something called as metaplasia. Last time in 2020 there was a image based question from metaplasia. Okay, I don't know, I'm not sure if it's for dental or medical, but there was an image-based question on metaplasia. Okay, now let us start with the first one, which is hypertrophy. Okay, I'm going to start with the first one, which is hypertrophy. What is hypertrophy and what happens in hypertrophy? Now, if you consider hypertrophy, the first thing which you have to know is it is, as you all know, it is increase in size of the cell. Okay, increase in size of cell. A particular cell, if it is of this size, it will just convert it to a bigger size. That's it. Okay. Now another very important characteristic of hypertrophy is that this happens in those cells which doesn't have much capacity to divide. Okay, that's very important. It happens in cells where the capacity to divide is less. Capacity to divide is less. Why am I saying this? When you will see the next one, which is hyperplasia. Hyperplasia happens in those. What is hyperplasia? Increase in number of cells, not size. So hyperplasia happens in those cells where the capacity to divide is very high. It's very important to understand these two differences between hypertrophy and hyperplasia. And if you consider hypertrophy as such, there is no much increase in number of cells, or there is not at all increase in number of cells. But one thing happens is, that's another difference which you have to notice, is that, for example, the protein content of this smaller cell is lesser. But when you consider the amount of protein content in a hypertrophic cell, the content increases. Okay, the amount of content increases, but the amount of cells doesn't increase. Okay, the number of cells doesn't increase, but the number of proteins increases. Okay, that's very important to understand. Though the number of cells doesn't increase, the number of proteins or contents, cellular contents will definitely going to increase. Okay, now another thing is, one similarity between hypertrophy and hyperplasia is that in both the organ size increases. Okay, size of the organ increases. Organ size increases, whether it's a size and increase in size of cell or the number of cells. The organ, whether it's spleen, it causes splenomegaly. Whether it's breast, it causes the increase in size of the breast. So this is a very common thing between hypertrophy and hyperplasia. Okay. Now, if you come on to the examples of the hypertrophy, which is much more important, it can be divided into physiologic and pathologic. Okay, pathologic. For physiologic, the typical example is during pregnancy. Okay, if you see, during pregnancy, the uterus undergoes hypertrophy. And please note here, the uterus not just undergoes hypertrophy, it also undergoes hyperplasia. So this is very important point to note down here. That is, uterus undergoes hypertrophy plus hyperplasia. Because what is the reason? Uterus has cells which has a capacity to undergo division. Okay, uterus has a cells which can undergo division. So it undergoes not just hypertrophy, it also undergoes hyperplasia under the influence of the hormones called estrogen. Okay, this is something which we will study in other subjects. Okay, under the influence of estrogen in physiology, we'll study this. So under the influence of estrogen, uterus undergoes hyperplasia as well as hypertrophy. Okay, now another very common example of the physiologic hyperplasia is the person going to gym, isn't it? He's taking this particular the dumbbells and all. What happens is the striated muscles, the muscles of the hand and all is composed of striated muscles. So this striated muscles undergoes hypertrophy. There is no hyperplasia because the skeletal muscle cells has no capacity to divide much. So it only undergoes hypertrophy. So these are the two examples of physiologic hypertrophy. Okay, physiologic hypertrophy. Now, if you come on to pathologic hypertrophy, you have a typical example, the cardiac muscle. Okay, the cardiac muscles. The cardiac muscles under the problem, under the influence of hypertension, if a patient is suffering from hypertension, what happens is blood vessels, there is vasoconstriction. Okay, so there is increased peripheral resistance, so heart has to pump at a much higher force, so heart adjusts itself by undergoing what is known as hypertrophy. Okay, it undergoes hypertension, it undergoes, under the influence of hypertension, it undergoes hypertrophy. Okay, it undergoes hypertrophy. So what happens? There is increase in size of a cell, and finally you can see that there is increase in size of the heart. Okay, what we call it in physiology or in medicine, we call it as ventricular dilatation. Okay, ventricular hypertrophy and ventricular dilatation. But if this stimulus continue, if the hypertension is not controlled, the patient can finally lead up with cardiac failure. Okay, it can finally lead to what is known as cardiac failure. So here is what a physiologic response. Okay, till here it is physiologic, no problem. Though it is, okay, I won't say that it's physiologic, it is pathologic, but now there is reversible cell injury. But once it reaches at this stage, there is ventricular dilatation and cardiac failure, which is irreversible, which we'll see later on. So it's basically hypertrophy, which is an adaptive mechanism. So this is about the different examples of hypertrophy. Okay, so what all did you see in hypertrophy? There is increase in the size, and thereby increasing the size of cell, there is increase in the size of the organ. Okay, now what happens here is the reason why hypertrophy happens and hyperplasia doesn't happen is because the cells have limited capacity to divide. And other thing which you have to know is that in both cases, whether it's hypertrophy or hyperplasia, the organ size increases. And examples, physiologic and pathologic. In physiologic, typical example is uterus and the striated muscles of the limbs or whatever organs we have during exercise. But the difference here is, in case of uterus, there is also hyperplasia happening, but in case of striated muscles, there is only hypertrophy happening. When it comes to pathologic, the cardiac muscles, due to hypertension, there is increased peripheral resistance, finally leading to hypertrophy and leading to some other pathologic changes as we go on. Okay, now let us discuss about the next topic or the next adaptive mechanism, which is the hyperplasia. Hyperplasia. So now, if you discuss hyperplasia, as I've already told you, it is what? It is increase in number of cells. Okay, number of cells. And what is the speciality of this type of cells is it has got the capacity to divide. Okay, there is increased capacity to divide. Okay, capacity to divide. Okay, now when you come on to the types, okay, when you come on to the types as previously described, there is two types, which is physiologic again, and there is also what is known as pathologic. Okay, there is also pathologic. Now here the physiologic itself is divided into two types. One is hormonal. Okay, hormonal. Physiologic itself is divided into two types. One is hormonal and the second is compensatory. Okay, two types, hormonal and compensatory. I'll explain this. Physiologic itself is divided into two types, hormonal and compensatory. What is hormonal? Now we've seen this example that in case of the female breast during the pregnancy or during the puberty, it undergoes hyperplasia. Okay, under the influence of various hormones, it undergoes under the influence of hormones. That is why it's hormonal. Okay, it undergoes hyperplasia. Okay, now compensatory means this is the capacity of certain organs which has a capacity to divide even during the adulthood. You know, if a piece of liver is removed, okay, a piece of liver is removed, then what happens? It can undergo regeneration. So regenerative capacity is due to this hyperplasia. Okay, so if you see that even if 80% of the liver is removed, only 20% is remaining, still you can see that after 12 hours, very important to note this, after 12 hours, what happens is this hyperplasia, okay, increase in number of cells, is noticed in case of liver. So that is compensation. A piece of liver is removed and it is compensated by hyperplasia. So hormonal and the compensatory, both are physiologic. It doesn't need to be pathologic. Now when it comes to pathologic, there are different examples for this. Okay, so one typical example is, see, during menstruation, you know that the endometrium, the muscular covering of the uterus, get proliferated. Okay, it gets proliferated, and what is proliferation? Basically, it's hyperplasia. Okay, the endometrium of uterus undergo proliferation. Okay, and this proliferation is usually controlled by two hormones, which is estrogen and progesterone. Estrogen and progesterone. Okay, now there is balance. Okay, the proliferation is balanced by these two hormones. We'll study this more in detail as we go on to physiology. Okay, it's balanced by estrogen and progesterone. Now what happens if there is an imbalance between these two? Okay, if there is an imbalance between these two, then we get a pathologic. So it's a pathologic condition. So if there is an imbalance between these two, you get endometrial hyperplasia, which is a pathology condition. Okay, so far we discussed the physiologic. If uterus is during pregnancy or during puberty, it is going hyperplastic changes, it is physiologic. But now when you come on to the other side, you have got that imbalance due to some external agent. If you are eating so much of fast food, if you're eating so much of foods which contains estrogen, so this balance between estrogen and progesterone is lost, and you get the pathologic change, which is endometrial hyperplasia. Now, one very important thing you have to remember here is that is it carcinomatous? Is it what is cancer? No, it is not cancer. It is a controlled growth. There is hyperplasia. It is pathologic. Okay, isn't it? It's pathologic, but it's not a cancer. It's just a hyperplasia which is happening, which is pathologic. Now, the very typical distinction between endometrial hyperplasia and endometrial cancer. Okay, endometrial cancer is this thing, that is, there is a loss of control in case of endometrial cancer. In case of carcinomatous change, there is a loss of control of cell division. Whereas in case of endometrial hyperplasia, very important to know that there is an imbalance of control, there is no loss of control. Please note this. There is an imbalance between estrogen and progesterone. There is no loss of control. The things are still under control. There is no loss of control. Okay, but when it comes to endometrial cancer, it is a loss of control. The loss of control over the cell division is happening, which leads to this particular condition of cancer. Okay, so that was one example, that is about the endometrium. Under the influence or imbalance of estrogen progesterone, this problem happens. Now, not just this, you also see this in another physiologic condition, or I would say pathologic itself, because wound is pathologic. So it should be classified in between, because wound healing is actually not a very physiologic thing. It happens physiologically, but it happens due to an external noxious stimuli, isn't it? The injury is due to external noxious stimuli. So in case of wound healing, you could see that the fibroblast, okay, the fibroblast, as well as the blood vessels, the capillaries, the blood capillaries undergoes hyperplasia. Okay, it undergoes hyperplasia. So that is the second example, which is wound healing, where fibroblast and blood capillaries undergo hyperplasia. Okay, now the final example is in case of certain viral infections like papilloma. Okay, papilloma and all, you could see that. Okay, you'll study this in pathology, in oral pathology, that in papilloma there is mucosal lesions and skin warts, dermatological warts. Okay, all these are due to epithelial hyperplasia. Okay, mucosal lesions are also due to this. Okay, so this is what is basically about hyperplasia. So what all did we study about hyperplasia? One thing is there is number of cells is increased, yes, and it happens in those cells which has got increased capacity to divide. It is divided into physiologic and pathologic. The physiologic again subdivided into hormonal and compensatory. Hormonal is like which is seen due to under the influence of hormones. The breast, the glandular cells in the breast undergoes, so to be very specific, the glandular cells in the breast undergoes hyperplasia. When it comes to compensatory, certain organs which has got the regenerative capacity, it regenerates, and that is very typical example is liver. Pathologic, you have got three example. One is endometrium. When there is imbalance between estrogen and progesterone, endometrium undergoes what is known as endometrial hyperplasia. The second example is wound healing, and finally the third example is papilloma. Okay, remember that papilloma is a hyperplastic mechanism. Okay, now finally we lead to the third type, or not final, second last, we come to the next next adaptive change, which is atrophy. Okay, which is atrophy. Okay, when it comes to the atrophy, the definition is decrease in size of the cell. Okay, hypertrophy is increase in size. Atrophy is decrease in size of cells due to decrease in cell substances. Okay, certain cellular substances, whether it's nutrients or whatever, there is a decrease in size of the cell. Okay, there is decrease in size of cell, which can lead to decrease in size of organ. Okay, decrease in size of organ. And a very important thing, when you see apoptosis, okay, when we study about apoptosis, there also we'll see that there is decrease in size of cell in apoptosis also. But what differentiate between this and the apoptosis is that here the cell is still alive. Okay, the cell is still alive. Okay, there is no death. In apoptosis, cell size decreases and cell is going to die or died. Here the cell remains alive. Okay, the cell remains alive. Now coming on to the next part, which is the causes of this particular atrophy. There are different causes. One is the immobilization or loss of function. Okay, loss of function. Okay, loss of function, that is, for example, you after a fracture you immobilize your leg for a longer period, there is loss of function, and this can lead to atrophy. Another thing is denervation, the nerve supply is lost, it can lead to atrophy. Okay, denervation. Then the third reason is the loss of blood supply. Loss of blood supply. Another very common reason is there is nutritional deficiency. Okay, nutritional problems. Okay, nutritional deficiency. Again, there is no enough nutrition to the cell can go undergo atrophy. And finally, there is hormonal stimulation. Hormonal stimulation. Okay, hormonal stimulation. Now very typical examples you could see if they ask you, okay, it's a kind of mixed denervation and loss of blood supply is usually what? It's usually pathologic, isn't it? Even the nutrition is also pathologic. Loss of function is also a kind of pathologic. But loss of hormonal stimulation in case of menopause. Okay, when a woman undergoes menopause, there is loss of hormonal stimulation and the uterus undergoes atrophy. Why? Because of, that's a physiological response, isn't it? Okay, one more thing due to which this happens is aging. Aging is again, it's a kind of you would say it's physiologic, it's not pathologic. Okay, and this is having a separate term, that is senile atrophy. Okay, senile atrophy. So what are they? There is loss of function, immobilization of fractured limb and all, denervation, nerve supply lost, blood supply lost, there is no nutrition, there is no hormonal stimulation. Very important, in this happens in menopause. Okay, this happens in menopause, which is a kind of this physiologic atrophy. Again, aging is another example for physiologic atrophy. Rest all are a kind of pathologic atrophy. Okay, now the mechanism due to which this particular thing happened, the mechanism due to which you could see that The mechanism due to which this happens, you could easily see that it's due to two things. One is decreased protein synthesis. Okay, decreased protein synthesis. The protein synthesis decreases naturally because there is no nutrition, there is no blood supply, there is no nerve supply, there is all this, there is no functioning. So there is decreased protein synthesis. And another very important reason is increased protein breakdown. Okay, increased protein breakdown. Now, with regard to this increased protein breakdown, there is two mechanisms, two things, or two factors involved here. Okay, one is ubiquitin proteasome pathway. Okay, ubiquitin proteasome pathway. So ubiquitin, there is a hormone, there is an enzyme called ubiquitin ligase. Okay, there is an enzyme called ubiquitin ligase, which is seen in the cells. Now, what this ubiquitin ligase does is, if there is nutritional deficiency, if there is disuse, or if there is loss of function or anything like that, what it does is, this ubiquitin ligase will go and it'll do something like this, it'll attach a ubiquitin to various proteins. Okay, if there is nutritional deficiency, what it does is it just attaches this, go and attaches. For example, this is a protein. Okay, imagine this is a protein. Now it goes and attaches a ubiquitin into it. Now once this ubiquitin is attached to a protein, okay, what happens is this gives a signal to a particular molecule called, or a particular organelle called proteasome. Okay, proteasome, and what it does is it just engulfs this protein. Okay, that is protein degradation. So for you don't need to know so much of detailed mechanism. Ubiquitin proteasome pathway is a pathway which is involved in this ubiquitin proteasome pathway is involved in atrophy. Okay, that is which is related to protein degradation. Ubiquitin proteasome pathway. Now, if you come on to this another mechanism which causes the protein degradation or protein breakdown is autophagy. Okay, when the cell is not getting nutrition, the cell eats its own components, which is actually proteins. Okay, the cell eats its own component, that is known as autophagy. Okay, so these are two mechanisms of what is known as atrophy. Okay, so one was the first thing which you have to know is decrease in cells size. Okay, due to decrease in cell substance, and this decrease in organ. Okay, but the cell is alive, unlike in case of apoptosis. Then the different causes we studied, the one cause is loss of function is there, denervation is there, loss of blood supply, nutritional deficiencies, hormonal stimulation, very important. It happens in lack of, okay, it's lack of hormonal stimulation. So I'll just write it there, lack of hormonal stimulation which causes this, and which is seen in menopause. It's a physiologic mechanism. Another is aging. Now, two mechanisms. One is decreased protein synthesis, other is increased protein breakdown. For increased protein breakdown, there is something known as ubiquitin proteasome pathway, and there is another mechanism called autophagy. Okay, where this ubiquitin is attached to a protein and it is being digested by proteasome. That's it. Okay, proteasome is an organelle which helps in the digestion of abnormal proteins. So that's it. Okay. So this is about the atrophy, and now finally we have to study about little on the metaplasia. The final one is metaplasia. Now, what metaplasia, the first thing which you have to know is that it is reversible. Very, very important to know. It is reversible. Okay, it's very important. Okay, don't forget that it is reversible. You can't even call it as cell injury. It's a reversible adaptive response, which is seen in adult cell type. Okay, it is. I'll tell you why this adult cell type is important. Adult cell type. Now, it's a reversible response in an adult cell type where one type of cell gets converted to another type. Now, this is, if you see it in an immature cell, okay, a undifferentiated cell, one type becoming another type is very common. Okay, it's very commonly seen in the blood cell formations, isn't it? When like different colony stimulating factors gets converted into erythrocytes. So different cell lineages are there. Let's study this in physiology, don't worry. But see, when this happens in an adult cell type, it is something special. Okay, this is This is already a differentiated cell, adult cell type, okay, and it's a reversible thing where one type of cell becomes another type. Okay, now typical examples. Okay, one very common example I would say is in smoking. In individuals who smoke, what happens in them is that here the cells, the ciliated columnar cells of respiratory epithelium, the trachea and bronchi, and are lined by ciliated columnar cells. Why? Columnar cells, the speciality of columnar cell is that they secrete mucus, and cilia, it will just remove the dust particles. Okay, it will just move the dust particles forward and it will just help it for digestion. So the respiratory pathway needs this type of cells because mucus secretion is required and cilia is also required to just push off the debris. Okay, now here, due to smoking, the ciliated columnar cells gets converted into stratified squamous cells. Stratified squamous cells. Now, what is the advantage of getting a stratified squamous cells over the ciliated columnar? It is much more. It can sustain some, like the injuries from smoke. Okay, this can stratified squamous cells are much more rigorous cells. They have much more capacity to sustain noxious stimuli. So this is actually again an adaptive response of a body. Okay, to to deal with the noxious stimuli. But what is the problem of this stratified squamous? I told you, yeah, it's good thing that it can withstand this particular noxious stimuli, but is there the property of these two, like the production of mucus? No, there is that the capacity, that is there cilia for this? There is no cilia. Okay, there is no cilia in stratified squamous. So cilia, what it does is it pushes off the debris. So this is not happening, and as a result of which, this stratified squamous epithelium will get converted into malignant. Okay, it becomes malignant. Okay, because there is no though there is an adaptive response, but there is no protective response. Okay, there is no protection, there is no mucus secretion, there is no cilia to just push off the debris and all. So the injury will keep on adding up, and finally what happens if the smoking is not being stopped, it can lead to malignancy. Now I told you it's a reversible response. So if the patient stops smoking, it can go back to the ciliated columnar epithelium. Now another typical example I want to tell you is in case of vitamin deficiency. Okay, vitamin deficiency individuals. Vitamin A deficiency. Okay, vitamin A deficiency individuals. Now, if you will study this in biochemistry, when we discuss about vitamins, that vitamins are very, very important for what? For differentiation of epithelium. Differentiation of epithelium. Now, uh, if there is deficiency of this particular vitamin, this it will just, you'll see that again the respiratory epithelium and other epithelium, you could see that there is that squamous metaplasia. Okay, squamous metaplasia. If there is vitamin deficiency, there is squamous metaplasia. Squamous, the same thing we saw here. The ciliated columnar becomes stratified squamous. But the reason is different. It is vitamin A deficiency which is seen. Now, is it that every time this squamous epithelium becomes columnar? No, it can, sorry. Is it every time that ciliated becomes squamous? No. In case of gastric mucosa, if you see gastric mucosa, okay, in those patients who have got chronic gastric reflexes, okay, GERD, okay, chronic gastric esophageal reflex syndrome, okay, or disease, gastric reflex. So in these patients, what happens is that the squamous epithelium, the gastric mucosa is made up of squamous epithelium, stratified squamous epithelium. So in this case, if there is chronic gastric reflux, the squamous epithelium becomes columnar, stratified columnar. So it's exact opposite. Okay, so you have to note three examples here. One is those of smoking, and second is vitamin A deficiency. In both cases, columnar becomes stratified squamous. In case of chronic gastric reflux disease, okay, the squamous epithelium becomes columnar. Okay, in the gastric mucosa, we need more kind of squamous epithelium. Okay, to withstand the acidic the acidity of stomach and all. Okay, so even the pH of different hormones out there, everything. So we need a much more squamous epithelium. But here in this case, we have got it gets converted to a columnar epithelium. So this is all about cellular adaptations. I'll just quickly review them. We have studied what is normal cellular adaptations and how it leads to cell injury and all. And then cellular adaptations, there are four types. Hypertrophy, where we see that there is an increase in size of cell, and it happens when there is no capacity to divide and the organ size increases. Examples are physiologic and pathologic. In physiologic, we have got uterus and the bodybuilder's striated muscle, but in case of uterus you can also see hyperplasia, but which is not seen in the striated muscles. Where in case of pathologic, the cardiac cells or cardiac muscles in case of hypertension undergoes hypertrophy and finally leads to irreversible changes. Then we have got hyperplasia, the number increases in those cells with capacity to divide is there. So two types, physiologic and pathologic. Physiologic are of two types again, compensatory and hormonal. Hormonal seen in breast, okay, influence the glandular mucosa or glandular cells. The glands or the glandular cells undergo hyperplasia. Then compensatory liver within 12 hours, the hyperplasia starts. Pathologic, you have got three examples. One is endometrium undergoes endometrial hyperplasia, and the second is wound healing where fibroblasts and blood capillaries undergoes hyperplastic, and finally the viral papillomas where warts and mucosal lesions this happens. Then atrophy is decrease in size of cell, thereby decrease in size of the organs. Okay, and the cells are alive when compared to apoptosis. The causes are either loss of functions, okay, either is loss of functions, there is denervations or blood supply being affected, nutritional problems, or lack of hormonal stimulation, which is seen in menopause. It's physiologic. Aging is another physiologic response. Mechanism: decreased protein synthesis and increased protein breakdown. So increased protein breakdown, you have got there is a pathway which is ubiquitin proteasome pathway, and also have a mechanism called autophagy. Okay, then coming on to metaplasia, it's reversible, very important. It's reversible, and it is seen in adult cell type where one type becomes another type. Example is smoking and vitamin A deficiency. In both cases, you see the respiratory epithelium, the ciliar columnar becomes ciliated columnar becomes stratified squamous. Okay, and if in case of gastric mucosa, it's opposite, squamous becomes stratified, squamous becomes the columnar. Okay, so that's all about the first part of cell injury. Now in the next class, I'll discuss a brief understanding of what is the mechanism of reversible and irreversible cell injury, and then we'll go on to the irreversible cell injury. Okay, and in detail about the mechanisms of apoptosis, how it happens. It's very important. There's extrinsic and intrinsic mechanisms of apoptosis which you have to understand. The caspases, all those things. So which will be discussed in the the coming lectures. Okay, so see you in the next session. Goodbye.